Hello everyone, welcome to Clinical Concepts with Dr. Atifa. In this video, we will learn a very simple and systematic approach to a patient with hyperthyroidism and hypothyroidism. And this approach is useful for FCPS, MD medicine, MBBS examinations, and clinical practice. In this video, you will understand the key clinical features, systemic approach to examination, differentiation between hyper and hypothyroidism, short case presentation, and important investigations. So let us begin. Whenever you approach a patient, start with general observation. A patient with hyperthyroidism usually appears thin, restless, anxious, and may have excessive sweating. In contrast, a patient with hypothyroidism often looks tired, slow, overweight, and may have dry skin and puffy face. Many clues can be obtained before even touching the patient. Now examine the hands. In hyperthyroidism, the hands are usually warm and moist. A fine tremor may be visible when the patient stretches out the hands. In hypothyroidism, the hands are cold, dry, and rough. Always check for tremors because they are a classical sign of hyperthyroidism. Next, look carefully at the eyes and face. Hyperthyroidism, especially Graves' disease, can cause protruding eyes, lid lag, and lid retraction. Patients with hypothyroidism may have periorbital puffiness, sparse eyebrows, and an expressionless face. These findings can strongly suggest the diagnosis. Now examine the thyroid gland. Inspect the neck for any swelling and observe whether it moves during swelling. Palpate the thyroid to assess its size, consistency, tenderness, and the presence of nodules. Finally, auscultate for a thyroid bruit. A thyroid bruit is highly suggestive of Graves' disease. Next, assess the cardiovascular examination. Hyperthyroidism commonly causes tachycardia, palpitations, and sometimes atrial fibrillation. Hypothyroidism is associated with bradycardia and low cardiac output. Always check the pulse rate and rhythm carefully. Now evaluate the nervous system. Patients with hyperthyroidism usually have wrist reflexes and fine tremors. Patients with hypothyroidism often shows delayed relaxation of ankle jerks. This is very important examination finding and is frequently asked in examination. Now look for additional clinical features. Hyperthyroidism may cause weight loss despite increased appetite, heat intolerance, diarrhea, and menstrual irregularities. Hypothyroidism may cause weight gain, cold intolerance, constipation, and menstrual disturbances. These symptoms help support your diagnosis. Now, when presenting the case, you can say this is a patient with clinical features suggestive of hyperthyroidism or hypothyroidism. Examination reveals characteristic findings involving the skin, eyes, cardiovascular, and nervous system. Thyroid examination shows relevant abnormalities. The diagnosis will be confirmed with thyroid function test and further investigation. Keep your presentation concise and systematic. To confirm the diagnosis, order thyroid function tests. These include TSH, free T4, and free T3. You may also request thyroid antibodies, thyroid ultrasound, and radioactive iodine uptake studies when indicated. Remember, laboratory confirmation is essential. Important cause of hyperthyroidism includes Graves' disease, toxic multinodular goiter, and toxic adenoma. And common causes of hypothyroidism include Hashimoto thyroiditis, iodine deficiency, previous thyroid surgery, and certain medications. Always think about the underlying cause. Let us summarize. Start with general appearance, examine the hands, then eyes, neck, pulse, and reflexes. Fine tremor, tachycardia, and eye signs suggest hyperthyroidism. Puffy face, dry skin, and delayed ankle jerk suggest hypothyroidism. And finally, confirm your diagnosis with thyroid function test. Thank you for watching. Don't forget to like, share, and subscribe to my channel for more clinical examination videos.